In today's COVID-19 update, we speak with the Honorable Minister of Health, Dr. Frank Anthony, about a software called COIN. It's a software that's being used by the government of India to track its vaccination progress. We also spoke with the minister about the 2020 match between the West Indies and Pakistan and whether spectators will be allowed to attend that cricket match at the Ghana National Stadium at Providence. The minister also addressed some developments at the Enmore Polyclinic.
Well, the ministry, we have a program generally to upgrade the facilities for maternal and child health in the country. We have done a lot of improvements at the Georgetown Public Hospital, and more recently, we would have completed a maternal waiting home in Lethem. So as part of this national drive, we want to upgrade these facilities in every region. And so in Region 4, on the East Coast at Enmore, we'll be adding a waiting home. And what a waiting home basically is for mothers to come there, those with uncomplicated pregnancy, they'll come there maybe a day or two earlier, and they would be able to deliver their babies at that facility. We have a number of things that we want to do on that site. So one, they'll be able to come there for regular checkups. The facility would be equipped with things like ultrasound and so forth so that proper dating and diagnosis can be made. And of course, when you come, you stay in, you'll be able to deliver your babies there. And if it's necessary, the facility would also be equipped with minor surgical theaters for those types of operation that might be necessary. This facility would complement what exists at Enmore.
Minister Anthony also noted a few other areas of development at the Enmore Polyclinic.
This new set of services would be integrated with the services that we are already offering. At the Enmore Polyclinic per se, we'll have to repair the polyclinic because there are a number of deficiencies that are currently there. The floor, the walls, some of the room, to repurpose them to make sure that they're better utilized and so forth, and to upgrade the services that we're offering. So monies have been set aside through this year's budget to enhance the polyclinic at Enmore. So that's one. Two, for many years now, the Enmore Polyclinic was promised X-ray machine, and while a machine was put there some time ago, it never worked. So I'm hoping that within the next 2 weeks or so, that we can have a functioning X-ray machine placed there, because the facilities are all built to accommodate an X-ray machine, but none was really working there. So there are three sets of things that are happening at that site. One, the repairs to the existing facility. Two, extension of the existing facility. And three, adding a maternal waiting home in the compound of the facility.
Right, Minister Anthony, thank you so much. The second question I have for you, back to COVID-19. So we were told that the Indian government is developing a particular software. I think the name is COIN, and that at some point that will be made available for us. And that software, of course, is to track vaccination. Could you give us a bit of an update on that?
As you know, in India, they have been doing mass vaccination, and millions of people have already received the vaccine. However, to track how many people have received the vaccine on a daily basis, they have developed a software to be able to aggregate all these numbers from the different vaccination sites. That software is called COIN, and it has been working very good in India. So the government of India has decided that they want to make the software available to countries who would like to use it, and they have made such an offer to the government of Guyana. We are very much interested in it because we believe that it would help us to aggregate the numbers of, from the different sites that we have. Currently, we have about 100 sites. So it would make aggregating these numbers quite easy, and we'll be able to track almost on a minute-by-minute basis how the vaccination is going, because that's how the software is built. Of course, they'll be customizing it to suit our purposes here in Guyana.
All right. I know that we have been keeping records since the vaccination process would have started. Based on what you've been briefed about in terms of the technical details, would there be a need for us to go back and maybe add some more information to what we've already been taking?
No, our record keeping has been quite comprehensive. Not only do we have the name of the person and address and telephone numbers and so forth, but we have also been tracking the vaccine, type of vaccine, batch number, serial number, and a whole host of other technical things that are required. So we have very comprehensive information, but the information is not in a user-friendly manner, and that's what this software is going to change. So when we get the software, we'll be able to input all this data that we've already collected. And of course, those persons who are now coming to the centers, we can do that directly. And then we'll be able to see a lot of trends and patterns and so forth. Things that we have to do now, basically mechanically, we'll be able to generate that from the software.
All right, thank you so much, Minister. I have a question from Newsroom, and they're asking with, in particular, the 2020 international between the West Indies and Pakistan. And they were asking basically with 120,000 persons now fully vaccinated in the country, if the ministry would consider allowing spectators at these sporting events.
These are discussions that we have started with the Ministry of Culture, Youth and Sport, and we haven't concluded those discussions as yet. So as soon as we finish those discussions, Minister Ramson would be able to update the public pertaining to what the outcomes are.
Here now is the daily COVID-19 vaccination update.
So as of today, we have 240,392 persons with first dose vaccination, which takes up the number slightly to 49.4% of our adult population. And for second dose, we have 123,050 persons. That brings our percentage to about 25.3% of our adult population.
Today's Mythbuster. You should not take the COVID-19 vaccine if you're breastfeeding. Yes or no?
You can take the vaccine if you're breastfeeding. There's nothing that says, there's no counter-indication why you shouldn't take it. However, if you have any doubts, consult with your doctor and they'll be able to give you detailed explanation. But there's no reason why you shouldn't take the vaccine.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.